A woman in her 80s who tested positive for COVID has, as WA reported, 3,602 new cases on Sunday. There are an additional 19 people with COVID in hospital, taking the total to 122, but the number in intensive care remains at 5. The weekend has coincided with a steep decline in both testing and reported daily infections, which reached a high of 5,005 on Friday, but have since dropped on consecutive days. There were a total 14,090 PCR tests on Thursday, which fell to 9,222 on Saturday. Your cookie settings are preventing this third-party content from displaying. If you'd like to view this content, please adjust your cookie settings. To find out more about how we use cookies, please see our cookie guide. The latest, the fourth of WA's Omicron wave, is the second reported this week, after a woman in her 40s was revealed to have with COVID on Monday. The state's active caseload now stands at 24,126 cases, 88% of which are in Perth and Peel. The southwest is next highest, followed by the Pilbara, Goldfields, Wheatbelt, Midwest, Great Southern and Kimberley. The latest reported cases bring WA to the brink of 50,000 total COVID infections since the start of the pandemic, a mark that will be eclipsed on Monday. Chief Health Officer Andy Robertson has said he expects WA's daily infections to peak at around 10,000 cases by Friday, which would require a big spike in coming days. Premier Mark McGowan remains hopeful level 2 restrictions, which include capping home gatherings at 10 and limiting hospitality venues to a maximum 150 patrons, will be removed by the end of March as planned. I am extremely keen to get out of it because I know what it does, Mr. McGowan told the Sunday Times. It's debilitating for businesses and difficult for people. But it's another tool that is helping save lives at this point of time, so we just have to see at the end of March where we are at. Camera icon Chief Health Officer Andy Robertson Ian Gillespie of the West Australian. The Premier highlighted WA's far lower hospitalisation rate than other jurisdictions at similar points in their Omicron outbreaks, as evidence the state was relatively well placed. Victoria, when they hit 5,000 cases back in late December, they had 395 people in hospitals, 55 in ICU and 14 people dying, Mr. McGowan said. At the same point of time, we have 92, 3 people in ICU and 0s at this point of time. What we have done differently to them is, we got our vaccination rate up to incredibly high levels, including the third dose, before such time as we had widespread of the virus. And secondly, we have all the setting and all the measures, including rapid antigen tests in place.